So I have no disclosures. Just like any consultation for any procedure that you do in your office, there's the assessment, and then there's the counseling the patient on the risks and benefits. But it's also important to know that the consultation could be required by your state law. It is in my state. And so I'll just go through each of these. Who does the consult for a laser hair removal? Like I said, may be written in your state law. You can find these laws on your state's professional licensing site, or you can, dive into the legal code, or the ASLM's website has a good reference that is based off of this paper from Dr. DeGiorgio and Avram. But in the state of Utah, which is where I practice, the consultation is written into the code. And the laser consultation can be delegated by an MD or a nurse practitioner to a PA, an RN, a master esthetician, or electrologist. And then after the consultation is done and documented in the chart, the treatment can be done to any of the above or to an MA. So basically, anybody can do a laser hair removal treatment in the state of Utah, whereas New Jersey is different. And as you're talking to someone about the potential for their laser hair removal, you're automatically looking at their skin phototype, their hair color, their hair thickness, their hair location, previous laser treatments, prior waxing and plucking. All of these things Christine touched on in her talk, because these affect the way the hair removal works. So when you're looking at their skin phototype, you're deciding, do I have the right laser to safely and effectively treat this skin type? And if you don't, then obviously you don't do the treatment. You're looking at the hair color, and you're really, intensely looking at the hair color, because something that looks dark may not actually be if you are looking at it in the right light. Obviously, lighter hair colors are going to be more difficult to remove because there's less melanin. Same with hair thickness. Thinner hairs are more difficult to remove. Christine talked a little bit about hair location, the depth of the target, but also any hormonal concerns. For women and facial hair, we never promise 90 to 95% permanent hair removal. We talk about routine maintenance and hair removal treatments once yearly because it's a hormonally triggered area. You're also looking to see if this is a sun-exposed area. Tan skin is probably, in our practice, like acutely tan skin, someone who recently went on vacation, and not that chronic actinic bronzing is the biggest reason for a complication, at least in my practice, especially with laser hair removal and with IPL. And then you're looking at location also for the risk of paradoxical hypertrichosis, so treating the hair and getting more hair. We ask them about previous treatments because we want to know if they've had other complications, what are their expectations, did they have any, poor results. And as Christine touched on, sometimes when you treat hair, it shrinks them, miniaturizes them, and it makes it more difficult in subsequent treatments, to treat them. And the hair obviously has to be in the follicle in order for the hair removal to work, so they can't have plucked or waxed at least 2 weeks prior. And then after you decide they're a good laser hair removal candidate, you move on to counseling them on the benefits and the risks of hair removal. So we talk about the process and procedure of the hair removal. So I always tell patients that, what to expect. This is a series of treatments. We're going to do treatments, every 6 weeks. the longer wavelength lasers do take more treatments. And so I usually, if we're going to use an ND YAG, I usually say 8 to 10. If we're going to use a shorter wavelength, I usually say 4 to 6. And to be completely generic, I'll say, it's going to take you about 8 treatments to get 90 to 95%. I tell people we can't treat them if they're tan. We require everyone to shave the area that they're going to have treated before they come in. It takes a lot of time, and it's frankly, dangerous to have them shave in the office because you don't remove all those little pieces of hair, and if they're sitting on the surface of the epidermis, the laser is targeting them, and you can have some complications. So we tell everyone in our text message before they come to shave the area prior, and it saves a lot of time and heartache. And then as far as aftercare, we always put 1 layer of high potency topical corticosteroid on and tell them to stay out of the sun. As far as pain control, I think that laser hair removal is probably one of the most widely variable treatments as far as pain goes. Some people think it's like a nothing, and some people think it's the most painful thing they've ever done. And if there's one thing I've learned in practice is that pain is so subjective and variable, and you can't really predict who is, going to have a lot of pain. So we talk about topical numbing, and in our practice, we usually make people come in so that we apply the topical numbing, and they sit there for 30 to 60 minutes before we do the treatment. But there are cases where we would prescribe topical numbing and give them very strict instructions on how to apply it. So putting topical numbing on under occlusion is dangerous if done in wide areas. We do that in the office, but not any more than the size of the patient's 2 hands. And wide areas like legs and that kind of thing are not done in our office, and we counsel people not to do that at home either. And then I tell them what to expect. So they'll get red, itchy bumps around the hair follicle that may last up to a week. Because we're only treating the hairs that are in the anagen phase, 20% will fall out with each treatment. All of the hairs will go away, and then 80% will grow back, and 20% will be removed, because it depends on what the ratio is of the anagen to telogen, but that's generally what I tell people. And then I always have, tell them this shouldn't happen, but reasons to call would be blisters or open wounds. Obviously, it's much easier to have a good outcome on a complication if you intervene early. So, we tell them reasons to call. It does probably get us more phone calls than we would the worried well kind of phone calls, but we'd rather see that than the other way around. And then I tell them about rare side effects. That's lighter, darker skin and the paradoxical hypertrichosis. And for every single laser that I have in my clinic, I think this is probably what this talk or what I can is most valuable to share with you is we have this sort of a handout for every single one of our lasers. It's in the ASLMS handouts for this talk, but we customize it, and we always say, what is it, how to prepare for it, how to treat yourself afterwards, what to expect, and reasons to call. And for every laser, our patients get one of these handouts.